it be like to be the leader of a public health nonprofit organization? Now, you might be wondering, what exactly are you referring to here, Chris? Well, let me break it down for you. I've got this great guest. His name is John Atkinson, and he and his team help lead an entire province within the country of Canada, Ontario, just under 15 million people, and their main responsibility, public health, improving health outcomes for that entire population. Now, how does he do this? Well, he and his team, they work with several different partners, ranging from government partners, partners within public health, and also, just public health experts. And they provide scientific research and evidence and guidance to policymakers. And oftentimes, their recommendations ultimately shift and shape policy for that entire province. So yeah, it's a big deal. In this conversation, we get into all of these things. As far as what public health is, John does an excellent job of breaking down the breadth of all that it encompasses. We also get into his role and responsibility as a leader, how he manages that. And further, we also get into some of the challenges associated with the work. For example, social media, misinformation. How does he manage those particular elements of his job? We also dive into his past. How did he get into this line of work? There's so much contained within this conversation. Today, this highlights video compilation. We're going to hit on a few of those things, but I do encourage you to go check out the main conversation, the audio version, and you can do so wherever you access your podcast. Just do that search for Life as a ... All right, well, why don't we get into things? Now, to kick things off, it probably makes sense to have John break down public health. So we all have this really good idea of what it truly encompasses. And plus, by the way, if you are somebody who wants to get into this field, you have this drive to give back, to serve others, well, listen closely, because there are a number of different professions that John lists off that, again, fit under this umbrella of public health. So check it out.
And so I think public health can be anything from the design of a community and how walkable it is and how accessible transportation is. It can be how safe is the water that people drink, or when they go out to eat, how safe is the food that they eat. It can represent the policies that shape the communities that people live in. So how available or accessible are illicit drugs or legalized drugs like alcohol or tobacco or cannabis that people can access? How supportive are the communities in terms of what your definition addressed, which was the determinants of health? What are the determinants of health? They're things like income, education, employment, housing. All of those things actually play a bigger role in determining health than did I eat my 5 servings of veggies or did I go for a longer walk today, or that kind of thing. So how do we create supportive environments that deals with the underpinnings of health, so making sure that people have sustainable livelihoods, and then they're actually supported in eating healthy, like getting accessible and affordable food. So public health is all of those things. So it's many things. From programs, services, policies, it encompasses so much.
Now, getting back to John and his role as Executive Director of Ontario Public Health, I thought it'd be interesting to kind of break down his day and, find out what he is truly involved with. So here's a clip of John explaining his work.
I get the great pleasure and privilege of working with a whole slew of health professionals in both community and public health. And that ranges from nurses and their nursing leaders, public health inspectors, librarians, dental professionals, dietitians, epidemiologists, researchers.
Diverse group.
Yeah.
Yeah. And we're an association. So we represent the views of those working on the front lines in public
Hmm.
health, community health. So what's really cool about it is you ask where I invest my time. I'm
Yeah.
meeting and I'm reading and I'm getting informed about what are the needs at a community level, at a provincial level, at a countrywide level in terms of what's going to support people to be healthy. I'm
Mm.
also learning about what are the gaps in the system. So, in Canada, there is such a shortage of all sorts of health professionals. So, we know that human health resources are a real problem and challenge right now. The
Yeah.
workforce is strained coming out of the pandemic. People have left many professions. There's been turnover. So I learned
Mm.
about those gaps. And then I learn and I collaborate with these folks about how can we actually make it better. So what are
Mm.
the policies? What's the advocacy we need to do? What's the research or the reports that we need to create that will help makers make
Mm.
better decisions and
Yeah,
address
yeah, yeah.
gaps? Um, so that's kind of part of what I do.
It's a big part,
I'm
I'd say. I mean,
actually
that sounds like a fairly involved aspect of your work. You're
it
synthesizing
is
a lot
it
of
is
these different opinions and ideas and taking that information and bringing it together in such a way to present to somebody else to perhaps move this project forward or this initiative forward. I mean, that unto itself would seem like a full-time job, just that. But sorry, continue.
Yeah. Yeah. No, you're right. It's big. And I think, such is public health and such is health, is that there
Mm.
are so many players and so many ways that health are impacted and so many needs. There's no shortage of needs or challenges.
Yeah, I
So
bet.
then, yes, it's figuring out how do you understand those needs, package them in a way that makes sense, that's informed by research and the evidence, and then
Yeah.
take them to the decision makers. So that's kind of like the second part of my big
Okay.
part of my job is I get to like meet with elected officials and
Okay.
civil servants and leaders, thought leaders, and influencers who are making a difference in health,
Mm.
and then bring these solutions or
Yeah.
advocate. Sometimes it's advocating and saying,
Right.
that's not really going to be good for people's health, or
Yeah.
here is a healthy public policy and how we can
Mm.
solve a problem.
Now, in this next clip, I want to get into John's past a little bit here. What got him into public health? What was his driving force or motivation to push him into this sphere or into this field? And here's John explaining a really influential moment within his life that really opened up his eyes to the world and all the possibilities that truly exist within, this realm of serving others. Being driven by this idea or this notion of helping society and the betterment of society. Like, how did those ideas take shape? You could tell me a little bit about that. Was that something like nudging within your family, or maybe somebody like a role model within your family? This was just where
It
did
was
that
not my
evolve?
family.
Yeah.
So in my family, I came from a long line of lawyers,
All
a
right.
couple of judges.
Okay.
Um, so that was the expectation I grew up with. My parents had moved here. Both did not get a post-secondary education. So we'd gone from very educated individuals in my family from the Caribbean. So my family is from the
Yeah.
Caribbean. And they moved to Canada for, as many newcomers do, for a better life for their children, education, opportunity, etc.
Mm-hmm.
And so I was pretty much funneled towards law and or business. Like business would be
Wow.
like a
Yeah.
second fallback.
Yeah.
And so I applied for business and I got a
Mm.
full scholarship. It was called the Canada Trust, or it was before Canada Trust was TD, the Canada Trust Community Scholarship.
Mm.
And to go into business. I had a job, I would have had a job every summer.
Yeah.
And I, at the age of 16, had the opportunity to go overseas to Dominican Republic and to work with a youth group there to paint and repair and reopen a school that had closed,
Okay.
preventing many children from being able
Yeah.
to go to school. And
Mm.
that transformed my life at
Opened it
age
right
16.
up. I
Yeah,
bet.
it totally blew it up. It blew it up. It turned my like whole perception of privilege
Yeah.
and, developed versus developing
Hmm.
nations, and like, just how lucky and privileged I was to be born where I was, from the
Yeah.
family that I was. And it kind of changed my outlook on life a lot. And so
Certainly.
while I didn't tell my parents, um, I waited until the last minute before I was to start university in business.
Yeah.
And 2 weeks before I was to start, I told my parents, I'm not going. Like, I don't know what I want to do,
Yeah.
but I want to help
It's
people.
not
Like, I want
this.
to make,
It's not that. Yeah.
it's not that. Yeah, it's not that. It's not making money. And that was what had been kind of programmed into me, that that was success. And so it kind of started there. And then I took that year to really explore what the heck
Yeah.
could I do with my life.
Yeah.
And it wasn't health. It wasn't health promotion at the time.
Mm.
But it was like, there are all these different kinds of ways you can help
Right.
and make.
It's sort of right.
Yeah.
Broader sort of ideas of at least having that notion or sorry, that idea of like, well, I want to help people. In what capacity, it's still undecided, but this is my guiding light. This is the wind in my sails, if you will, and how that sorts itself out, you can kind of figure that out along the way. I think that's what a lot of people do. But as long as you have that broad sort of idea of where you'd like to be heading, you put yourself out there enough, which you certainly did, opportunities just sort of come about. And I think when talking about careers, a bit of serendipity in there as well. And before you know it, things evolve the way that they do. All right, I have one more clip that I want to show you here today. And this one involves John breaking down, how he manages some of these massive, massive tasks and responsibilities. He gets into some of the things across his career when, for example, he was running the Canadian Cancer Society. As you can well imagine what that would entail, campaigns that run across the entire country, but then also too, returning to the Ontario Public Health Association, again, 15 million people. Some of these jobs, some of these responsibilities, they're massive. Now, how do you manage that as a leader? What do you do? Overwhelm, some of those things probably creep in at times, but how do you combat that? How do you fight that? And here's a clip of John breaking that down for us. One thing to say that, yeah, you're attracted to these things, but for example, okay, yes, then you land those positions, you get into these executive leadership roles, and then they throw it on your desk and say, all right, John, this is what we're faced with. This is what we need to do. And I mean, I'm assuming at least anyone probably be a bit wide-eyed when they survey all that needs to be done, and certainly the level of importance and significance of some of these tasks or challenges put in front of you. What was that like initially, or were you just steel-eyed and like, yeah, all right, well, this is what we need to do. Boom, 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 boom.
Yeah, no, I think there's probably a few themes throughout my career. One is a feeling of overwhelm.
Yeah, I
For
mean, but
like,
yeah, I would assume.
and
I
and
think
getting
that's natural, right?
discouraged. Yeah, and getting discouraged just by like the breadth and weight of how many things go wrong,
Yeah,
or you take
yeah,
3 steps forward in one area, and then let's say a different politician gets elected, and they take 2 steps back, or they change the
right,
policies
right, right.
so hard. So I think overwhelm is for sure one. If I think about my like shoes off self, my natural tendency, it would be like free flowing and easygoing, and
Yeah,
creative processes, and unhinged, unencumbered, kind of like out of the box thinking,
right.
and all the things that would make organized people extremely
Crazy.
annoyed with me.
Yeah,
Yeah. So I would say, so the first thing I learned early in my career was good planning.
yeah,
And so taking those really big, hairy, audacious goals, and frankly, breaking them down into smaller goals, and developing plans around them.
yeah,
And so that, like, my planning skills, even though it's totally not my natural tendency, I've learned them. And so that's
Mhm.
been super duper helpful. Like, I cannot tell you how much those planning skills have helped. All right, well, we are drawing to a close within this video, but I would like to remind you, this was just a sampling of some of the topics contained within the main conversation that I had with John. I mean, there's so much more contained with the audio version. We get into some of those rewards of the work,
again, some of the challenges. We touch on aspects of technology, things like AI, how that's shifting and changing the game of what he's doing and his organization's involved with. So I do encourage you to go check all of that out. You can do so wherever you access your podcast. Just do that search for Life as a ... All right, well, also one favor I do want to ask of you really quickly. I would appreciate that like or subscribe. It's the only way to really get this content out in front of others and to make a difference, right? It might be just that video lines them up for the next 30, 40 years of their life doing something that they love. So the best way to kind of increase the odds of that happening, liking and subscribing. I do encourage you to check out the next video. It'll be coming right next week, so don't miss it. All right, we'll see you then.